Hello all. Today I'm going to inform you all on the effect that the nursing shortage in the U.S. has on healthcare. The nursing shortage across the U.S. has become a serious epidemic that needs more acknowledgement. Did you know that by 2022, 1 million new job openings for nurses is projected due to growth and replacement issues? As humans, our loved ones, as well as ourselves, will need adequate healthcare in times of sickness. But what if there aren't enough nurses to provide this safe and quality care for patients? As a healthcare worker myself, I see firsthand the issues that this nursing shortage brings to the healthcare environment. Today we're going to focus on three things: the main contributing factors to this nursing epidemic, how these factors are affecting the healthcare environment, and what is being done in hopes to lessen the severity or in one day decrease this nursing shortage. Let's start by focusing on the contributing factors. There are many contributing factors, but today we're only going to focus on three, being the increased need for our aging population, insufficient staffing leading to nursing burnout, which causes nurses to leave the profession, and the significant part of the nursing workforce is nearing retirement. Going back to our first point, the increased need for our aging population, America has the highest number of Americans over the age of 65 other than any population. We all learned it in high school. The baby boomers are majority of our population these days. And these baby boomers are living more longer and active lives, increasing the demand for healthcare and lengthening their needs. Also, something that increases the demand for healthcare is chronic illnesses. So as people get older, the more illnesses they are associated with, and more chronic illnesses lengthens the severity for the need of health care. Insufficient staffing leading to nursing burnout. This is something we hear as nursing students all the time, something we're scared of, nursing burnout. It can be caused by many different things. We're only going to focus on a few, but one of them is due to increased patient load. So just adding that one patient really gets to the nurse. If you have 6 patients with each 20 meds and fluids to be hung and dressing changes to be done, it's a lot of work on the nurse. A brief economic analysis on a looming nursing shortage stated that 30 to 50% of all newly graduates either change jobs within the profession or end up leaving the profession altogether within 3 years of clinical practice. Our third point is that a significant part is nearing retirement age. So majority of our nurses in the workforce now will be retiring within the next couple years. The American Association of Colleges of Nursing created a 2018 study that stated 50.9% of the nursing workforce is ages 50 or older. Health Resources and Services Administration projected that 1 million nurses will reach retirement within the next 10 to 15 years, which there's not enough nurses to fill that gap now, which is why this nursing shortage is happening. This brings me to my graph. This is retirements, graduates, and foreign nurses projection in 2017 to 2022. This red line here is our retirees coming in at 500,000 by 2022. And this blue line is our graduates not reaching enough. So now we don't have enough nurses to fill those positions of the retirements. Now we're going to move to how these contributing factors are affecting the healthcare environment. So there are many major effects on how this is affecting the healthcare environment and patients and staff themselves. One point is that higher patient loads lead to higher and increased nursing errors, which nursing errors are giving a patient the wrong dose of medication, not changing their site when it's supposed to be changed, not changing the tubing of the fluids when it's supposed to be changed, not completing catheter care, things like that. The American Journal of Infection Control stated that there was a high correlation between increased patient loads and the incidence of UTIs and surgical site infections, so not cleaning around that catheter and not properly cleaning a surgical site incision. It also is correlated with higher rates of mortality. So the American Association of Colleges of Nursing stated that just increasing the patient by 1 increases the likelihood of a patient dying within 30 days of admission, which is huge. There was also a study conducted that found lower patient nurse ratios was significantly correlated with lower mortality rates. Lastly, let's talk about the actions being taken. So all hospitals do everything different. They try to get nurses in very different ways. But as a nursing student myself, these are two of the main that I've seen. One being recruitment, and then two being incentives or reimbursements for tuition or student loan forgiveness, etc. Going back to the first point, recruiting from nearby nursing schools, they do this by coming up with programs for newly grads that close that knowledge gap whenever they're first out into the real clinical setting, and helps them increase their clinical skills. Or they'll do nursing career fairs, which Southeastern just had one, where a bunch of hospitals from the South will come down and give students and let students know what they offer and what they bring to the table in hopes to recruit them. Our second point is tuition reimbursement or incentives. This is where if you sign a contract for, say, 3 years, you get $5,000 a year to go to student loan forgiveness or tuition reimbursement, which is something that hospitals do a lot. Or they'll offer, if you're a tech, they'll offer $1 more if you sign on with them as a nurse, or if you get a BSN, a bachelor's rather than associates, they will give you an extra $1 more as well. This is in hope to improve their retention rate and be way more attractive to nurses coming out of college. So in conclusion, we've reviewed how the worldwide nursing shortage has tremendous negative consequences in this world. The contributing factors pose effects on quality and safety of patient care. This action being taken, the tuition reimbursement and incentives, should continue to grow and could be continued. If the severity isn't brought, there will be a significant decrease in patient load and patient care and the safety of patient care. I'd like to leave you with a quote by Timothy S. Shavely, who wrote a brief analysis of the looming nursing shortage. He stated, "If America is to be continued to be a leader in the healthcare delivery throughout the world, a perpetual supply of highly trained and qualified nursing personnel is essential." And that's what I'd like to leave you with today. Thank you.